How many systems does it take to run a radiology practice? Many imaging centers juggle 10 to 15 separate platforms just to get a patient from order to results. Risks, billing, patient engagement, mammography tracking, payment processing. Every new system opens the door to more inaccuracies and data loss. It's fragmented, it's inefficient, and frankly, it's exhausting your team. Royal Health changes everything. We're the only cloud-native platform that integrates both risks and revenue cycle management, plus comprehensive patient engagement, clinical workflows, and operational automation powered by our AI agent, MJ. One comprehensive solution, one vendor relationship, one support team that actually answers the phone. What makes Royal different? We hire professionals with radiology and IT backgrounds. They've been in your shoes, they understand your workflows, your pain points, your daily challenges. That's why we don't just install software, we design and implement complete functional workflows that actually work for your team. In financial services, we expect 99.999% accuracy. 5 nines. When you swipe your credit card, it works. When you initiate an imaging order, your chances of executing that order pre-Royal, 68%. It's abysmal, and it's the patients who suffer. Practices using Royal see 70% reductions in no-shows, 80% faster check-in times, and 20% revenue improvements. With Royal's AI Care Coordinator, MJ, we're getting practices closer to that 5-9 standard. Because when we achieve 5 nines in healthcare, we're not just improving workflows, we're saving lives.